Why forehead flap is the ideal donor site for nasal reconstruction? Most of us are aware of only a single or possibly two reasons, but there are quite a few reasons as to why forehead flap is ideal for nasal reconstruction. As we all know, forehead flap is the Indian flap for nasal reconstruction, and medial arm flap, as popularized by Tagliacozzi, is the Italian method of nasal reconstruction. So, why the forehead? If we see the embryology of the face, the frontonasal process develops into the nose as well as the forehead. So embryologically, forehead and the nose develops from the same particular process. That is why their characteristics are similar. Therefore, the aesthetic outcomes when we use a forehead for nasal reconstruction is also better. Now, as compared to other donor sites, say for example the nasolabial region or for example the arm, there is minimal distortion of the facial landmarks when we use a forehead flap as compared to when we use the nasolabial region. So that is also one of the important reasons. We get large amount of tissue from the forehead without distortion as compared to other areas of the face. The forehead can be camouflaged comfortably with hair, it being on the forehead, as compared to other areas. In other areas, especially the cheeks, scars are also more noticeable as compared to that over the forehead. Even forehead as a donor site is less prone to functional impairment as compared to other donor sites. For example, if we are harvesting a nasolabial flap for nasal reconstruction, we are likely, at least likely, to damage some branches, buccal branches of the facial nerve, whereas that is unlikely in case of a forehead flap. So the functional impairment in forehead flap is much less, or the likelihood is much less as compared to other donor sites. So these are a couple of reasons why forehead flap is the ideal donor site for nasal reconstruction.